a lot of us don't know this, but a huge part of our immune system actually lies in the gut.
Things that can affect this is age, stress is a huge one, and environmental factors as well.
Before you jump to the expensive testing and the supplements, like, are you even chewing your food?
We actually absorb more nutrients from our food when we eat in the sunlight.
Welcome to Genestra Brands Gut Check, a 6-episode series where we teach you everything you need to know about understanding your gut health. In a world of health fads, quick fixes, and information overload, we want to simplify, educate, and empower Canadians about the vital role of gut health and overall wellness. In partnership with 2 renowned healthcare practitioners, Bisleen Attli, Naturopathic Doctor, Clinical Director, and TEDx Speaker, and Carley Nadine McConkey, Holistic Nutritionist, this series aims to dispel the myths and complexities surrounding gut health, offering reliable and scientifically backed information. Follow us on Instagram at Genestra Brands CA for more. Now let's dive in.
They're so incredibly interconnected, and one of the great examples is low stomach acid. This is something that I see quite often with a lot of my clients. And low stomach acid is essentially our digestive fire. So what that it's there for is breaking down our food, but it's also for our first line defense against any sort of pathogens or things that our body, we don't want in our body. So this is really, really important to make sure that the integrity of our digestive fire and making sure that we have enough what's called HCl, so it stands for hydrochloric acid, is really that first line of defense. And things that can affect this is age, stress is a huge one, and environmental factors as well.
Yeah, so important because with our stomach acid, right, and it comes with all the other enzymes and stuff as well, that really allows us to break down our food. And if we really want our intestines to do the job of absorbing the nutrients from our food, we have to make sure we have enough stomach acid so that our food is broken down as nice and small as possible, so that absorbing nutrients becomes really easy. I also find that sometimes with a lot of people, there's a lot of misconceptions around what even acid reflux is. So what it essentially feels like is you have like either like a burning sensation in your stomach, or you literally have that feeling of food just coming back up, out, and sometimes back into your mouth. So if you experience things like that usually means your stomach acid needs support.
IBS is something that, a lot of people do experience, and they maybe get a diagnosis from, but the thing about IBS, which can be very difficult, it's such an umbrella term, and it can be really hard to pinpoint what it is because it could be so many different factors. I would love to hear your opinions on it, but I know that mental and stress has such, like our brain has such an effect on IBS.
Totally, it's such a big gut-brain link, especially when it comes to that diagnosis. And I will agree with you in that sense too, is that there is a diagnostic criteria, but again, it's such a big umbrella term and can cover so many things. In general, if someone is thinking that their gut needs support, and what are some of those symptoms, like pooping is a huge one, right? Yeah. Do you go consistently to the bathroom? What does your poop look like? Yeah. All of that stuff. Bloating is another big one. Generally just how you feel after you eat food, and oftentimes I'll have sometimes patients even tell me like they can feel food just like sitting there or just not
fermenting.
Exactly. And then that's the thing too, right, is your body is constantly telling you signs as to how well it's working or not, and it's so important to kind of tune into that.
Absolutely. And a big one too when it comes to IBS and digestive issues is I know a big buzzword is SIBO, so small intestinal bacterial overgrowth. And essentially what this is when the bacteria from your large intestine goes up into your small intestine. And so we want to be able to have that, bacteria in different spots.
Yeah, and one of the most common signs I see with that one is if bloating, that usually tends to get worse as the day goes on. Yeah. Again, SIBO is such a big term too, so many symptoms can point to that, but that's a really, really common one that I see.
Yeah, I would say for myself, the first thing that we do before we reach for protocols or testing, what I do with my clients is laying the foundations and the most important things that are free and that folks can do right away that sometimes is often overlooked and so incredibly important would be, I would say my top 3 things. Number 1 would be making sure that you're sitting down when you're eating, making sure you're in a state of rest and digest, because we truly cannot digest our food properly if we are standing up and rushing around and in this state of stress. So making sure that you're sitting down. The second one would be to make sure you're actually chewing your food, because we had this conversation earlier where digestion happens before we even put food into our mouth. So our salivary amylase, which is our enzymes in our mouth, starts, we start salivating when we see and smell food. So being able to break that down, and I would say a great way to put yourself into a state of rest and digest would be just taking 4 deep belly breaths. This can be a simple and very accessible way to help you bring you into your body, get grounded, and put yourself in a state of rest and digest. And I would say lastly would be no screens. I think that's like nearly impossible for a lot of folks these days, but for some clients, I would say like even for lunch, like take your 20 minutes, it's okay. You can get back to work afterwards, but close your screens and just take that time.
Totally, and you just described mindful eating right there, right? And I have this conversation often with my patients too, right? Before you jump to the expensive testing and the supplements, like, are you even chewing your food? Are you connected with your body when you eat? Like, we really underestimate the power of our nervous system, and even when we look at conditions like IBS, there is such a big mind-body link to it, and oftentimes people's digestive symptoms get worse when they're in a high stress state. And what essentially happens is that when you're in a stress state, your body's nervous system state literally switches. And your stress nervous system is called the sympathetic nervous system. And when you're in that state, everything in your body constricts. Okay? And that includes your digestive tract. So you're not going to digest anything well when you're in that state. On the other hand, the other nervous system that you want to be in is called the parasympathetic state. This is literally called your resting and digesting state. And when you're in this state, it's like everything opens up, blood is flowing, you're feeling calm and relaxed, and it's in that state that your body can actually absorb the nutrients.
Absolutely. And some little tips that I absolutely love that I've been trying to incorporate more is eating in community. So like eating with people that you care about, not always eating in isolation. Like that can be really, really helpful. And then eating outside is so amazing. I've actually seen research done that we actually absorb more nutrients from our food when we eat in the sunlight, being grounded. So bonus points, I always say to my clients, if you are able to eat a meal outside.
I mean, the last thing to emphasize, it's not about 100% perfection, right?
Definitely.
I love to eat a good slice of pizza while watching a movie, but it's all about, at least making sure you're doing it 80% of the time so that your body really reaps the benefits. So specific conditions can be associated with specific strains of bacteria. So if you take a probiotic that is specifically designed for a condition, it can really better support it. So for a condition like IBS or such a big gut-brain link, there are specific strains of probiotic and bacteria that can actually be beneficial for you. And I know that Genestra does have an HMF IBS product that is specifically designed to kind of support some of those symptoms that IBS might bring.
What I love about the Genestra IBS formula is that it has specific strains that is specifically for IBS type symptoms. So it's taking out a lot of the guessing work.
So a lot of us don't know this, but a huge part of our immune system actually lies in the gut. And your gut and your immune system are directly connected. And one of the ways that they're connected is that your gut cells are all kind of lined together, as I explained before, in these like really tight junctions. And that's very important because obviously your intestines don't want any sort of pathogens to come through. But what happens over time is that if we eat a lot of processed foods like sugars, drink a lot of alcohol, this like gut lining, this mucosal layer essentially gets irritated and kind of gets smaller and smaller and smaller. And now we have that irritation and pathogens directly on the gut cells, and then these tight junctions essentially start to separate. And when they separate, pathogens essentially kind of start to go through. And I mean, even when that mucosal layer starts to get irritated, our immune system gets triggered and it gets activated, and this kind of starts an inflammatory cascade all throughout our body. And it can lead to symptoms like allergies and sensitivities, even types of autoimmune diseases, arthritis. All of this can actually stem from our gut because of the link with the immune system.
Absolutely. And it's important to make sure that we have a healthy microbiome, which is enough good bacteria, because when we're exposed to the bad bacteria, we want to make sure that we can crowd out that bad bacteria, those pathogens that will, take up space in our gut if we don't have enough of that good bacteria.
Totally. And this really what ends up happening too is that it just causes our immune system to work on hyperdrive all the time. So if you're someone who's like getting sick all the time and whatnot, it could be also because of this.
I have clients that tend to get sick quite often. We do look at things like stress, but digestion's like one of the number one things that we look at, because supporting that integrity of like the good gut bacteria and reducing inflammation and things like we just discussed is so incredibly important for the immune system. So I would definitely say first and foremost would be with food. So I think one of the big ones would be incorporating things that are really easily digestible. I think that sometimes we can get so stuck on quote unquote healthy foods, which are, the salads and the smoothies, which are things that can sometimes be quite hard to digest. But I think it's really important for people to realize that we are very much, based in seasons. We're very cyclical beings, that, having more warming foods in the winter like stews and bone broths and cooked vegetables are really, really important because they're easy to break down, and they can really help with the integrity of our digestive fire. And that's, like, as we mentioned, our first line of defense. So having really easily digestible foods, bone broths, which are really high in collagen and gelatin, which can be really, really soothing for the gut. So I would say food first and foremost can be really, really helpful when we want to support the gut.
And speaking off of the food thing too, just being mindful of other foods like, sugar. Sugar actually freezes our immune cells. That's what the research has shown for a number of hours. So really being mindful of the sugar intake, and even alcohol, as you mentioned before, it kind of irritates that gut lining and can really kind of wreak havoc on our immune system and the integrity of our gut. So kind of just being mindful of the consumption of some of these foods as well becomes really important. Aside from food, one of the other things to also consider is supplementing your body with specific vitamins and nutrients to really support a healthy immune system. So vitamin D is, of course, a super important one to consider supplementing with. Very important you get the right testing done so you can get the appropriate dosage for yourself, especially because in the winter we don't really get as much sun. So if you live in one of those climates, very important to supplement with that. The other thing to consider as well is supplementing with a probiotic. So Genestra does a great job of, again, having specific probiotic formulas for specific conditions, and they have an HMF immune, and it's been shown in physically active adults to actually improve symptoms of upper respiratory tract infections. So, things like sneezing and coughing, because it does have those specific strain of probiotics that support the immune system.
Amazing. Yeah, I love recommending the Fit for School for a lot of my clients with kids, because it can really reduce upper respiratory tract infections and things like that. Things like sore throat, coughing. So this is a great first line defense. And what I love about the Fit for School too, it's really easy for kids to take. So there's a chewable one that's really good and it tastes great. And then there's a powder form as well that you can just, put in applesauce or put in food. That's really easy to take. So yeah, I definitely trust these ones.